Hello guys, welcome to my channel. So today we are going to discuss about hip joint special test. So first one is the Patrick's test. It also called Phallips test and figure 4 test. So in this test, patient is in supine line. Therapist one hand on the unaffected ASIS and another hand on the affected knee. Then examiner slowly lower the knee of the test leg on the table. Knee is flexed in like a figure 4. You can see in the picture. Then if a test is negative, it indicate that affected leg lower to the table or parallel. If the test is positive, then the test leg above the opposite leg, which indicate iliospasm or SI dysfunction. Means sacroiliac joint dysfunction. Then you go for the Trendelenburg sign. So this test is done to detect the abductor muscle of the hip is weak or tight, whatever. To test the abductor muscle, we can do Trendelenburg's test or sign. In this test, normally pelvic on the affected side will be raised when patient stand on the affected leg. So unaffected leg is raised, and in affected leg patient can stand. If the pelvic drop on the unaffected side, it indicates stand leg or abductor are weak. Means the affected leg abductor are if weak, then the unaffected side will be drop. Then it indicate abductor weakness on the stand side. Then you go for the anterior labral tear test. So in this test, patient is in supine line. Examiner place hip in full flexion, abduction, external rotation as a starting position. Then extend the hip with combination of internal rotation, adduction and extension. If test is positive, it indicate pain and click. Then you go for the posterior labral tear test. So in this test, patient is in supine, starting position of hip is full flexion, adduction and internal rotation. Then move into extension, abduction and internal rotation. If the test is positive, it indicates pain or click with click or without click. Then we go for next test is called Krigas test. It done to measure the femoral anteversion or forward torsion of the femoral neck. So in this test, patient lie in prone, knee flex to 90 degree, palpate the greater trochanter by doing leg externally and internally rotated up to find the greater trochanter. It also called Radar's method. If the excessive anteversion, so how we can detect if excessive internal rotation of hip means more than 60 degree and external rotation is limited. Internal rotation is more than 60 degree and external rotation is limited, then we can know there is increased femoral anteversion. Then you go for talk test. So in this test, patient lie supine close to the edge of the couch. Test leg is extended until pelvic begin to move. One hand is medial on the thigh and another on the posterolateral aspect of ankle. Then hold for 20 seconds. If patient having pain, so there is capsular tightness. Then you go for Stinsfeld test. So patient lies supine and flex the hip with knee straight to 30 degree of the hip flexion against resistance. If hip or groin pain, it indicate positive test, which may cause due to posterior hip pain, indicate due to SI dysfunction. Then we go for a line is called Nilton's line. So it start from ischial tuberosity of pelvis to ASIs. If greater trochanter is palpate above the line, it indicate his dislocation of the hip. Then you go for our next test is called Brand's Strangle. So in this triangle, with the patient lying supine, patient draw a perpendicular line from ASIS to table, then other from greater trochanter to the previous line. Then measure both sides. If there is difference, it indicate coxavara or congenital dislocation. Then you go for leg length. So for test for the leg length, we have two tests mainly. One is true length, another is apparent or functional length. So first picture is the true length. So patient lies supine with first examiner square the pelvis, then ASIS to medial malleus measure by a instep. 4 to 8 inch is normal. If slight difference, then 1 to 1.5 centimeter is considered is also normal. For segmental test of the leg, therapists start doing from iliac crest to the greater trochanter, then greater trochanter femur to the lateral condyle of femur for the measurement of femoral length, and from lateral condyle of femur to medial malleolus to measure the tibial length. So this one is the segmental test of a leg. Then we go for another is called a second one is the apparent or functional length. So in apparent length there is no anatomical, only pathological shortening is happen. So it tests from tip of xiphisternum or umbilicals to medial malleolus. If not same as normal with normal leg, then it caused due to maybe obesity or muscle wasting is also then fine. Then you go for standing functional leg test. So in this test, patient relaxedly standing. Therapist palpate the ASIs and PSIs and noted the asymmetry. If the asymmetry is indicated due to a side joint dysfunction with gluteus maximus, quadratus lumborum on the test. Then you go for a muscular test like a first one is the Thomas test. It is used to assess the hip flexion contracture. Examiner place the patient in a high sitting position. Hold the normal leg, knee in both hand. Lie. Hold the knee in chest. Affected side thigh, if not touch the couch or slightly flex, it indicate contracture of the hip joint or iliopsoas muscle, hip muscle. So how you know that the patient hold the unaffected leg and lie down. If the affected leg not touch the couch or slightly flex, then there is tightness of the iliopsoas. If the leg not flex but slightly abducted, it indicate IT band tightness. And if a leg is slightly knee is slightly extended, not fully flexed, then it indicates rectus femoris tightness. Then you go for the next one is the Alias test. So patient lie in prone position, affected knee is fully flexed. If the buttock is left, then it indicates rectus femoris contracture or tightness. Then you go for the Obese test. In this test, patient is lying on the affected side, limb is up, affected side limb is up. Then examiner passively abduct and extend the limb, knee is straight or flex 90-degree. Then examiner don't hold the limb. If limb is drop or negative test, so the negative test is happen when the leg is drop. If positive test, then the leg is placed and don't fall. Okay, so then we go for a Nobel compression test. So it used to know that IT band tightness or not. So patient lies supine with knee flex to 90-degree, hip is flex. Examiner apply pressure on the thumb in the femoral condyle from 1 to 2 centimeter. Maintain the pressure. Patient slowly extend the leg at 30-degree of flexion. If severe pain on the lateral condyle, it indicate IT band tightness. Then we go for the piriformis test. In this test, patient is in sideline. Flex the test hip with 60-degree with knee flex. Stabilize the hip with other one hand and other hand is downward pressure to the knee. If tight pain on the buttock or registered external rotation, it can cause piriformis tightness. Then you go for the Phallips test. So Phallips test, patient is lying prone. With knee is extended, then examiner abduct the both the leg and knee are then flexed to 90-degree. Then examiner try to abduct the hip. If abduction is increased, it considerably positive test for gracilis muscle tightness. Then we go for our next test is called Fulcrum Test. So in this test, it helps to assess the stress fracture. So patient sit with knee bent. Examiner place arm under thigh and apply pressure on the knee. If positive test is patient having sharp and severe pain or apprehension sign on the fracture side. If test is negative, then patient don't feel anything. And thank you.